very senior, very well qualified neonatologists across the network, which are about 15 number. And we have about 200 dedicated nurses trained only towards recovery and treatment of very sick newborn children. This manpower caters to the high-end NICUs that we have, which are very well equipped to take care of these sick newborns. And like CEO just mentioned, that we are capable of, and just yesterday at one of our centers, we have discharged a pair of twins who were just 24 weeks old and who spent 100 days in our NICU. So besides these, we also conduct a PG training program, for postgraduate medical students across the network for training in neonatology. So this is where we are in terms of the network. Coming specifically to Bangalore, Dr. Pratap, Dr. Suresh, Dr. Deepa and their team have been doing an incredible job in terms of not just treating the newborns, but recovering them and treating them from far-flung areas, really far away from Bangalore.
And we are one of the pioneers of that. So we were one of the first teams in India to bring that from UK after the research. And we have done now 120 babies total body cooling ಮಾಡಿದೀವಿ, but for a different condition. That's called birth asphyxia. ಅಂದ್ರೆ ಹುಟ್ಟಿದ ಬೇಬಿ ಅಳದೇ ಇರುವಂತ babies. As we speak, ಇವಾಗ ಒಂದು baby cool ಮಾಡ್ತಾ ಇದೀವಿ. So that is also a baby which is born in another hospital, did not cry. So ಅದು brain damage na prevent ಮಾಡಕ್ಕೆ. But here we thought if you lower the body temperature, heart rate should automatically come down. So that was the theory and thinking behind it. So and then we discussed with the experts, but we know ಈ treatment ನಾವು ಬೇರೆ babies ಅಲ್ಲಿ already ಕೊಡ್ತಾ ಇದೀವಿ. So it is not unsafe. It is a safe treatment. But ಈ condition ಅಲ್ಲಿ ಯೂಸ್ ಮಾಡಿರಲಿಲ್ಲ. ಯಾರು ಯೂಸ್ ಮಾಡಿಲ್ಲ. ಇಂಡಿಯಾನಲ್ಲ ಯಾರು ಯೂಸ್ ಮಾಡಿಲ್ಲ.
Hello everybody, I'm Dr. Pratap Chandra. I'm a neonatologist and consultant lead at Motherhood Hospital Bangalore. This case is about a baby who was delivered almost about 250 kilometers away from Bangalore in Andhra Pradesh, and this baby was noted to have a very racing heart, a very high heart rate of about 250 to 280 per minute. Normally a newborn babies would have a heart rate of around 120 to 160. So this heart rate being so high is called supraventricular tachycardia, SVT in short. So babies, when their heart rate is going so high for a long period of time, they can have heart failure, and then the heart will fail to pump the blood, and then a lot of these babies can die. The treatment for this is medical treatment. You are giving medications called adenosine. In some cases, if it is not treatable with that, you keep giving more medications, for example, amiodarone, beta blockers, flecainide. So there are a lot of other medications that can be given. In our case specifically, what happened, the baby did not respond to any of the medical treatment. So we waited for a little bit longer for the medicines to work, only because the baby's heart was good and functioning well. By second day onwards, we started noticing the heart was actually failing. The ventricular contractions were becoming weaker. So this is a time where we have to step in and then gave what is called as a shock treatment for the baby. So we administered 3 doses of shock treatment, and in spite of that, the baby's heart did not come back to normal. So when we give a shock therapy, usually the heart will stop for a fraction of a second and it will restart. It is like booting the computer basically. So when the heart restarts, generally it will go back to normal rhythm. So in this case, it did not go back to normal rhythm. So this is when there is a baby where you have tried a lot of medical treatment, you've tried giving shock to the baby, and heart is not functioning well. This is when we had to go out of the box and then think about a novel therapy which can be used in order to save the baby. So this is when we administered a therapy called total body cooling, where the baby's temperature is brought down to about 33.5 degrees in order to make sure that the heart rate comes down. So by God's grace, it did happen. 4 to 6 hours after starting the treatment, the heart rate started getting better, and all the rhythm came back to normal rhythm. And we had to maintain this for some more time and make sure that the heart goes back to normal function. Then we started rewarming this baby very, very slowly, because if you're starting to rewarm, sometimes the rhythm will come back to the SVT. So luckily that did not happen. And then once we stopped the therapy, the baby's heart was functioning normally, and it had a normal heart rate of about 130 to 140, and then the rhythm of the heart was also normal. And then the baby was maintained on 3 medications for a period of about 1 month, sent back to where it came back from, and had a connection with the doctors there, continued the medical treatment in Anantapur, that's where the baby came from, and then made sure after 1 month we stopped all the medications. So we reviewed the baby after about 6 weeks, we repeated the ultrasound scan of the heart, and we were very, very happy to say that the heart was functioning normally, and then the rhythm was also normal. And this baby girl was a bundle of joy to actually look at.